Okay, so for the final week of lab for the SURT 1701 course, clinical orientation, so the 10th week of lab, we really are just kind of getting the students ready for clinical rotations for next quarter. So again, like I said in the last video, if the student had any skills that they performed during their competency assessment that were not proficient, we would want to make sure that we spend time remedially with them where they're going to have to re-demonstrate that for us and make sure that they know how to perform those skills before they go on to clinical education in the following quarter. But then we also have some skills that we're going to perform during that week 10. So we give the students an introduction into instrument handling. So we begin to learn the basics of how to hand surgical instruments utilizing the correct hand, the correct technique, and most importantly, safety. So in the progression notebook, you're going to see an explanation of just the various different types of information, some key principles to remember, and then just a description of how to hand those instruments. There are also some videos in the Moodle course on basic instrument handling, specific specialty instrument handling, and then also some information on assisting skills that would be great for your students to watch, either in lab or on their own as a review. You'll want to have a Mayo stand set up, have the student hand to a surgeon beside and a surgeon across, demonstrate, and then have the students practice as well. Okay. After that, you'll want to go through the manipulation of a laparoscope, which there's going to be a check off that's associated with this. But after the instrument handling information, there will be information to review for the students on tips for success on preparing the endoscope and then also maneuvering the endoscope. So how to get the endoscope ready, talk to them about proper handling of the endoscope, how we take care of the scope, how we want to make sure that we're not stacking anything heavy on it when we put it into the case cart, how the light cord attaches to the side and the camera attaches to the top, and just describing to them how we handle these pieces of equipment. Okay, talk to them about the different degrees of an endoscope and how the end is going to look different. Talk to them about the scope warmers that are available in your facility and what's going to be utilized. Okay, and then you'll want to talk to them about how to maneuver an endoscope. So how, make sure that they understand that with a beveled scope, when the light cord's at 12 o'clock, then it's oriented correctly. That makes sure the camera head is also at 12 o'clock, otherwise everything's going to be twisted and rotated on the screen. Talk to them about, slight movements, making sure that they're not going to run into other things, making sure they keep what the surgeon's looking at in the center of the screen and follow along with the surgeon. And as much as possible, you want to have them mimic the movements. If you have a simulated kind of a box or something that you could put a trocar in and put a scope in so that they could move around and just mimic how to manipulate that endoscope and follow a surgeon who's going to be working on the field. So just practicing that manipulation of an endoscope. If you have a 0-degree scope and a beveled scope, a 30-degree or a 15-degree scope, just so that they can see the difference of how you can manipulate both of those and just how one varies from the other, that would be ideal, but you'll just have to do with what you have available to use for your practice. So after you go through that information, then you'll want to perform that check off with them, which will be in that check off section, and you'll want to make sure that you sign and date that, and again we'll turn that in at the end of the course and keep that in the student's permanent file. All right, then we go into prepping the surgical patient. So we discuss various different preps. There are some videos in the Unit 7 for this course in the Moodle course where it goes through a betadine scrub and paint, a HIBA cleanse, a Dura prep, various different types of preps, and a Chlora prep, so you can have the students watch those. And then you would need to have your demonstrate those various different types of preps for your students. They then will need to perform the abdominal prepping checkoff utilizing a betadine scrub and paint tray. So you will need to demonstrate the technique for them and then have the students go ahead and demonstrate that technique to prep that type of an area. So again, that checkoff is going to be in here. You'll sign and date that for the students and then turn that in with the rest of the checkoffs for your students' permanent file. Finally, then we do a little bit of discussion about clinical conflict resolution. So in here, there's going to be some scenarios. So scenario 1 and scenario 2 that you can utilize to get the discussion going. But basically, we just talk a little bit about what their clinical experience is going to be like. Discuss with them what the hours will be, who they'll be working with in their clinical facilities, those kinds of things. And then also just talking about how to deal with difficult preceptors and just how to handle some of those types of situations, which the scenarios will do a good job of talking about some of those, but you may have some other examples that you'll want to talk about with your students. They tend to have a lot of anxiety about going to clinical. So just trying to discuss with them how it really will be a gradual process. We kind of start them in the circulating role, and then as they gain experience, then they'll gain responsibility. And just knowing that we're not going to throw them in right away and have them hand instruments. It'll be a progression. You know, they'll circulate, then the first time that they scrub, the main goal is just getting their gown and gloves on and standing at the back table. And then the next time, maybe they help put the knives on and maybe they drape the Mayo stand. And then the next time, maybe they hold retractors. And then the next time, maybe if it's like a carpal tunnel or a breast biopsy, then maybe they would be able to hand instruments. So we're not going to be throwing them in. It's a very gradual process, and they'll be very prepared for the responsibility that they'll be given at the various different times. So just spending some time discussing those situations with the students, helping to alleviate some of their fears before they go into the clinical experience, which will be coming that following quarter.